Hello, I am Dr. Vivek Dahiya. I work as an orthopedic surgeon in Medanta Hospital, Gurgaon. Welcome to Fit Tak. We are going to talk about osteoporosis and how to manage it. So osteoporosis is called as the silent disease. Its incidence is quite high. It is almost 18 to 19% prevalent in India. It is more prevalent in females compared to males because females undergo menopause, and after menopause they lose their estrogen hormone, which causes a rise in the incidence of osteoporosis. Almost 33% of females post menopause, that is after menopause, will have some or the other degree of osteoporosis. There are a number of risk factors for osteoporosis. The most common risk factor is being a female after menopause. Then there are some dietary problems, those who are malnutrition, people who take steroids for a long time, people who are coming out of a chronic debilitating illness. Some people have a family history of osteoporosis, so their osteoporosis may be a little more common. Those people who have a sedentary lifestyle, consume a lot of alcohol or have a lot of excessive smoking, they have an increased incidence of osteoporosis. So osteoporosis, I will repeat myself, is also called as a silent disease because we do not come to know how and when did our bones become weak. Commonly, patients who have osteoporosis, they come to us with what we call a fragility fracture. It means that they have a little injury but the bone breaks. Something that you and I, if we fall down, we will have nothing but a sprain, but people with osteoporosis will have a broken bone in the wrist, spine or the hip joint or any other bone. Before they develop a fragility fracture, they have some amount of fatigue, bone pains. Some people start stooping in the front, they have a curved spine, and some people comment that over the past few years their height has decreased. This happens because the spine, the individual vertebrae which make the spine, because of osteoporosis, they start getting compressed and the total height of the patient reduces. Bone density is measured by a test called DEXA scan. It measures the density of bone and it gives us a number. This number helps us in quantifying the amount of bone loss or osteoporosis that has happened. Classically, DEXA should be done in every female who nears menopause so that we come to know what is the condition of the bone density, and then either we treat it or we help maintain it. In males, bone density is required if there are high risk factors, as I have told before, or after the age of 75 in a routine screening manner. So one of the most important things that we can do to prevent osteoporosis is anything which is called as weight bearing exercise. So which can be as simple as walking for 45 minutes in a day, which can be playing something which involves a bit of running or sprinting, which can be football, tennis, or even doubles tennis or doubles badminton, which can also be some exercises in the gym which involves using weights. Weights need not be 30-40 kilos, it can be as less as 2 to 5 kilos. But weight bearing exercise is the thing which will prevent osteoporosis. This is the only natural thing that we can do to prevent osteoporosis, and also it goes to a large measure to treat osteoporosis. Other than this, in the younger age group, we should maintain an active lifestyle, make sure that we are not sedentary and indulge in some amount of sports. So once you have been diagnosed with osteoporosis, and to prevent a fragility fracture, we can do a lot of things. The first thing is we start walking, then we start doing some weight bearing exercises. Then third comes the role of medication. Calcium and vitamin D are used as a support to help make stronger bones. There are some medicines available which prevent the bone from becoming weaker, and there are some medicines available which actually will increase the strength of your bone. So these medications are started based on your profile when you visit your doctor. So the recent advances include a medicine called teriparatide. It is a synthetic form of parathyroid hormone, which is the only medicine available to us which actually increases the bone density. Rest all the medicines that we use till now, be it tablets or injections, they only prevent further bone loss. They do not increase the strength. Teriparatide helps in increasing the strength of the bone.